Hi, I'm Lydia Wietzma with Revelation Real Estate, and today in Solving Life's Next Chapter, we have the owner, Ann Ross, of Mobile Dentistry of Arizona. And this month, the month of October, is National Dental Hygiene Month. Thanks, Ann, for coming.
You are welcome. Thank you for inviting me. This is a great day.
Well, we have a lot to talk about, so we're probably going to have you come back because there's so much to talk about. But I know you personally because I've had my teeth cleaned by you, and I know how good you are, and I know how good your company is. But tell us a little bit about your mission and how did you get started in going through mobile dentistry? Mm-hmm. It's kind of a unique business plan because there's not a lot of mobile dentistry out there. So give us kind of your mission and how you started.
Well, many years ago, I noticed in private practice working for other dentists that some of my aging patients weren't coming back to me, which broke my heart. And being a dental hygienist, I was able to see their kids, their sons and daughters, and their families. And I would ask their sons and daughters when they would come in, how's your mom, how's your dad? And I would hear all different kinds of stories. So after several months of this, a few years, it started to really wear on me, and it bothered me because I knew their mother was around, their father was still with them, but not getting in for care.
Right.
So I would hear different stories. I had people ask me, well, couldn't you go see my mother over here? And I started hearing about senior living. I started learning a little bit more about it and realized that there was a void for our older population. There was something missing. And I really felt that I could fill that. I felt like I could make an attempt to help those people.
And I know transportation is a huge problem for adults and our senior population, and I think that's why so many companies that are mobile are actually very successful because a lot of them can get the services that they haven't had for a long time because of that. So
that is correct, absolutely. So physical and cognitive challenges on different people's behalf. It doesn't matter really what age, but certainly we do focus a lot. Our emphasis is with seniors, so with older adults. But we find just as many challenges physically getting to the dentist as we do cognitively as well.
So you, I know, focus on your seniors. So why are we focusing mainly on the senior dental care?
I feel that there's something missing. So there is a void. I don't think that the senior population is really scheduling for the care. I don't feel like they're receiving the care.
Right.
And I truly believe they are not maintaining optimal oral health, we call it.
Right.
So they're not able to manage their personal care in that respect.
Right.
It doesn't mean that they're not trying or that they don't want to. It just, as we age, we decline in many different ways, as you know.
Yep.
Whether we can remember to brush and floss our teeth and to do it correctly.
Right.
Or if we just don't want to care for ourselves. Maybe someone's suffering with depression or
dementia.
Maybe
even.
Someone's had a stroke and they're right-handed and their right hand is not functioning anymore.
Okay.
And it breaks their heart that they can't continue to care for themselves.
Right.
They may not reach out for help because they're so independent.
Right.
But they do need help physically. So there's so many different reasons. A lot of folks also that are retired are bedbound or homebound.
That is true.
And those are some reasons too to bring care to them, which is why we're mobile.
Right. So there is a correlation between a healthy person and good hygiene, right? Dental hygiene. Isn't that correct?
That is correct. And many people know, I think more people are really understanding that our oral health is directly related to our systemic health and our bodies. So when we speak about health and wellness or well-being, we know, you and I both know, many people know that is connected. Our mouth is a portal to the rest of our body. It's like a window. Whatever we put into our mouth goes through our body. So if we're cleaning teeth or checking teeth and there's a lot of bacteria in the mouth and the mouth's not being maintained, that can be introduced into the bloodstream. Just like if someone hasn't flossed for 10 years and they go back to their bathroom and start flossing, that bacteria then is entered into the bloodstream. And there's a lot of different things that can happen with that bacteria floating through the body,
right,
especially with the heart.
Yes, and I know that it used to be, correct me if I'm wrong, but it used to be that if you had a heart murmur, you had to get antibiotics before you got medication ahead of time. Because one of my daughters does have a heart murmur, and when she was younger, we always had to get an antibiotic or medication before her teeth cleaning. Yep. And I know that that has changed as well, because now she doesn't need to have that.
Many of those requirements have been lifted, but not all.
Okay.
So, for instance, if someone has a chronic kidney situation or kidney disease, there's different, and if a physician or a dentist really feels that that individual needs coverage, then they can prescribe that.
Right.
But certain heart murmurs, yes. Also for brand new joints. So a new hip, arm, wrist, certainly knee joints are really common. That for the first 2 years of that joint, that brand new joint, you need coverage.
I did not realize that, but
heart valve replacements would be for life.
Okay.
And that's very understandable, understanding that unfortunately, when people pass and autopsies are done, frequently they do find oral bacteria on their heart valves.
Interesting.
So medically, I'm digging into my journals and reading and learning about so many of these things. Yep. We do understand that the germs in our mouth are the bad guys.
Yes.
Actually, we have lots of germs, but there's only a handful that are extremely destructive.
Yeah.
But those are the ones that we're always trying to maintain.
Right. And I find it interesting that, a lot of times I'll talk to seniors that do or don't go to their dentist, and I'll ask, and they'll say, well, they just want to know about my history of my medical. And they don't realize that there's a reason why you're asking some of the questions that you ask ahead of time.
It is important because, for instance, many seniors, many individuals or adults are on medications or many medications, sometimes laundry lists of medications, which can directly impact their saliva flow. So it might cause what we call hyposalivation or a dry mouth. So most people know it as dry mouth or xerostomia.
Okay.
There are many products out over the counter that are available that you can use to help combat that, but it never will take the place of saliva.
Interesting.
Which buffers acids, which you know what acids cause cavities or caries.
Yeah.
So dry mouth with seniors is a really, really big deal. In fact, I do think the dental community, they now feel with adults or seniors, that's our number one cause of dental caries.
Interesting.
So there's a really big push to address that when we see our seniors.
Yeah. Do you find, I know you go to a lot of communities, and many of those communities have memory care folks within their communities. Tell us what you're doing for the memory care communities and what you have found from what you've done with those folks.
One of the things that I love to do, whether I'm offering or requesting to come in and help provide educational information for our caregivers or our CNAs, is to help with that oral care piece.
Right.
And I love to do that. If they can give me 30 to 40 minutes, I can get through my program with demonstrations from brushing, flossing, background on what they need to be doing, what their senior patients need to be doing, what they need to be helping them with, and how, and then also all the way down to denture care.
Interesting.
So that's what I can give to our senior living communities and help embrace the staff, to help educate them, to come full circle to help the resident. Right. So that's my passion.
As seniors end up aging and as they go into memory issues, they have a harder time remembering how to brush and when to brush, and that's when the caregiver kind of gets involved and shows them on a daily basis.
I think that it's even above and beyond showing the senior what to do, because I think for the majority, not all, but the vast majority, we need to actually provide it for them. Okay. So the one program that we do have that's a weekly oral care program is really popular. Okay. It's very, very affordable, but it's highly effective. Okay. So one of our most favorable, critical, and beneficial programs or services is very low cost. But that's the grassroots of keeping someone healthy. So we can drill and fill and patch and fix and replace teeth all day long, but we have to be able to maintain what we do and keep that bottom line, keep them healthy.
Right,
keep
right.
them healthy.
Absolutely, absolutely. So what are some of the things that you find that you're finding with what are some of the bigger things that you're finding with your senior population?
You know, I'm glad that you asked me that, because thinking of Dental Hygiene Month, which is October, one of my favorite months, being a dental hygienist, I think about, sometimes I push back from the table and I sit back and think about what I've done over the last 12 years being mobile. And I look at that and think, have I made an impact?
Right.
I think I've made a favorable impact.
I think you have too.
I think I've educated a lot of people,
Yes.
which I love. I think we've provided an awful lot of care.
Yes.
But are the seniors healthier? I think the seniors that we directly assist, yes.
Right.
But in general, if you asked me if the senior population is healthy as far as their oral health, I would say no.
Right.
It just hasn't seemed to change a whole lot.
Right.
And I'm not sure. I think there's a period of time where an older adult disconnects from that. It drops off, or they have what I call life happens, changes occur.
Right.
Maybe they've lost a spouse, they've relocated, they've started acquiring memory care concerns. And I think that disconnection from oral health or going to the dentist is a big problem.
Right.
Because it's hard. Number one, it's hard to get them back on track.
Right.
And number two, for them and their family to embrace that.
Right.
So you have a value system going on, and then you have the actual body, the health of the body.
Right.
So there's so many things involved with that, but I'm still feeling positive. I'm still pushing on with what we do.
I think a lot of it too is maybe education, and I just don't think, I know you're big into educating, and you've spoken at a lot of major organizations within your industry and others, and I think part of it is just that we haven't, as a society, hasn't educated enough of our seniors and the caregivers and the families to say this really is important and this really needs to be done to keep them healthy.
One of the things that when I go to my dental hygiene conferences, we talk about these things. Certainly, one thing that was brought up, which I think is amazing, is oral care directives.
Okay.
How many people have oral care directives?
I don't know. I've never even heard of it, actually.
I do. So my kids have promised that my oral care will be optimal, even when I'm 106, like my grandmother. So, but if you think about it, who is going to manage that? Think about what you go through every day with your beautiful teeth, brushing and how tedious that is.
Yep.
Who is going to be managing that?
And it depends on who, some people
who's
like
caring for you.
Exactly. Like my mom will brush her teeth 3 times. Every time she eats, she brushes and flosses.
Wow.
So, I mean,
she's the minority.
And it's also, I think it also depends on you. Like if you're one that only thinks brushing once a day is okay, then maybe you're going to take care of your parents that way. Where maybe if you brush 2 or 3 times a day, maybe you feel that that's once a day isn't enough. So it's all in perspective, right?
And everyone's health is different too.
Yeah.
So there are some people that can sneak by brushing once or twice a day, and others that continue to have tooth loss.
Right.
Even though they are brushing and flossing because they do have periodontal disease.
Yep.
So
Tell us what periodontal disease is, because I hear that a lot in the senior industry, and I don't think people really know what that is.
Right. Before I do that, I wanted to mention one thing.
Okay.
Caregivers are amazing. Caregivers have so many different skills, but I will add that providing oral care for someone else is tedious and it's not easy. So even if you were to brush or floss your child's teeth and they're moving around or resisting and things like that, it is difficult. So there is an art to that.
Yep.
And it also takes someone that's willing to do that and trust the other person's not going to bite and things like that.
Absolutely, absolutely. And I know you educate. I know when
tips and tricks.
Tips and tricks. When we'll do that on the next show.
We'll do that.
We'll do that on another one. So
that would be fun.
I think that's good information.
Right.
So,
but as far as periodontal disease, so what that is, peri is around, dental is the tooth.
Okay.
So it's disease around a tooth, basically that's affecting the ligaments, supporting structures, and the alveolar, the jawbone.
Okay.
That's holding the teeth in place.
Okay.
So basically, back to the bacteria, we have hundreds of bacteria in our mouths at all times. We acquire them at a very young age. Right. From our families, from our friends, and so we have anywhere from 4 to 6 different types that cause periodontal disease that are very destructive. So if we're not diligent with maintaining our oral health, that can take over.
Right.
If our systemic health declines, if our immune system decreases, if we're having some of those challenges, guess what happens? They become very opportunistic, and they take over. And also people that smoke, people that have diabetes, they struggle a whole lot more with their oral health, and also their periodontal health. So, again, our systemic health makes an impact with our oral health, and conversely, back and forth. So, with periodontal disease, I would say it's around 75% of our adult community has some form of periodontal disease or another. And that begins with gingivitis, which is inflammation and bleeding of the gums when they get tender, all the way up to wiggly teeth and tooth loss. So, and we do have a lot of seniors. I was in Tucson working this past weekend. We had a lot of folks there that I was caring for with very loose, very wiggly teeth.
Interesting.
And so that is not a healthy scenario. That's not a healthy scenario. So
is it fixable if they, depending on when they catch it, or when
you have lost significant supporting structure and bone around the tooth, that is pretty difficult to overcome. The tooth usually is removed so you don't swallow it. Plus, you do need to remove the disease. Okay, so if the tooth is removed, the bacteria leaves. So if all of the teeth, let's say someone has, every tooth is diseased, and we remove all of the teeth, and that disease is gone, it's removed. But then we need to think about tooth replacement.
Absolutely.
If an individual is able to or has the means for implants, implant-supported dentures, maybe in a memory care setting, some sort of, there's all-on-4, there's hybrids, there's all kinds of systems. Or just dentures. If someone's not able to function and utilize dentures because of their cognition, that can be a situation that can be difficult.
So there are some options for those that have gotten to the point where they it's more of a an extreme cases type situation.
We actually, a couple years ago, we went to a senior living community, and we saw a lady that had so much periodontal disease and so much infection. Our dentist did not do anything that day. He needed to contact the family, get some consents to remove some of the diseased teeth. By the time the paperwork came back, within just a few weeks, she had passed. So we had heard it was pneumonia. Well, we see a lot of aspiration pneumonia and a lot of pneumonia with our senior population from the oral bacteria in our mouths.
Interesting.
It's very deadly. Very, very deadly.
I did not realize that. I knew there were a lot of dental and physical connections, but that actually does make sense. So
we were shocked, and we were very upset about that. But it did make sense because of her disease-ridden mouth. It was very sad. And her daughter, who is very caring and very loving for her mother, said that her mother would not go to the dentist her whole life. So in that situation, it's more of a value system and her beliefs than it was maybe the means. Her daughter was not able to hog tie her or force her into it. But then when she became the power of attorney, she wanted us to assess her mother just to make sure she was okay, which she was not. So...
And I know you see a lot of major issues because you are in the senior communities, and you bring your van and you tell us about that. I've seen it, and I know how you operate, but for those that have never seen a mobile dentist room, tell us kind of what you have, because I think some people are they're already scared to go to the dentist to begin with, but then when you have a mobile
mobile office,
it's
traveling. It is exciting. We have a colorful wrap on the vehicles. We now have 3, so each year we add another vehicle. We're thinking about another one next year. Because we do utilize the vehicles 24/7. And so it is hard on a vehicle. But it does have a friendly wrap with pictures and friendly faces on the outside. We do have a certified medical lift on board. We can bring people up inside safely.
Even those that are in wheelchairs.
Absolutely.
And things like that.
They always come up in a wheelchair, even if they're mobile. So it's like a hospital setting where they enter, yet very friendly with my staff. And my staff is highly skilled in caring for people, whether it's transferring them into the dental chair that's inside, or caring for them, hand-holding, coaching them. through treatment or something like that, and their family can come up inside as well.
Yeah.
So it can be a friendly environment, very, very efficient, excellent care, and able to finish our procedures or our care and get them back inside for bingo, or their hair appointment, or dinner, or whatever the case is.
And I've actually been in those, and most of them have 2 chairs in one.
We have, at this point in time, we have 1 or 2 in the mobile offices.
Okay.
So we do have opportunity to work with folks in their wheelchairs and not be transferred or transfer into the dental chair. So we have full flexibility.
Yeah.
And if they can't come inside for whatever reason, we can detach the equipment and come inside to see them.
Oh, okay.
So there's no pressure if they don't want to come outside, which most of them do, by the way. Most of them want that outing.
It's fun to go into that RV.
They like the social outing. They like to get outside, and they do. They like to see the weather.
What I love about your business and the people that you hire is you're very cautious of the people that you're very caring as far as, I think it's because a lot of these people either haven't been to a dentist in a while, or that they are very nervous.
Right.
So if someone's cold, you have blankets for them. You explain everything as you go along. This is what I'm doing next. This is how it's going to feel. This is how it sounds, so that they aren't so scared about hearing some of the things that are there, because some of those machines make some really strange
and we
noises.
also use music therapy. It kind of depends. If mom doesn't really understand what's going on, but maybe she needs to have a filling done or impressions for a new denture or something like that, we'll have daughter there, maybe holding her hand, maybe not.
Yeah.
Maybe I've talked with power of attorneys and families on the phone, and I'll let them visit with their mom or dad in the chair.
Yeah.
And we'll make it fun.
Yeah.
We'll totally keep their mind off of what's going on.
Yep.
And be as efficient as possible.
I've seen it, so I know that's it. Yeah. And it's hard to describe it to someone if they've never seen it, but
and there's no waiting, so I think that helps. Once they enter,
I agree,
they're welcomed and they're on the spotlight, so we can help them right away, and there's no waiting around, or
you're not sitting in a room for
you're not sitting in a waiting room waiting, because that does make people anxious, even myself.
Absolutely. And waiting in a cold, sterile room while someone, it's just very nerve-wracking. And I know that your rooms are very warm and inviting, and not
they look home-like.
They
look
don't
home-like. A lot of our equipment is in cabinetry.
Yep.
So until we open the cabinets and
you don't see
do
anything.
something.
Something. Exactly. So tell us a little bit more about how you have 3
mobile offices that travel throughout the state.
So you go all over Arizona, and give us some information on some of your, I think some seniors especially that are on Medicare, either they have insurance for dental or they don't have insurance for dental.
I'm finding that, and just to back up a tiny bit, we do know that in this country, dentistry is still, unfortunately, considered a luxury. In my opinion, it's a necessity.
I agree with that.
Know. I think many people would agree with that. Unfortunately, it's still separated.
Yeah.
I think many people now would like it to be considered a medical necessity.
Okay.
And what does that look like as far as funding? I'm not sure. Or insurance. I think insurance is just complicated and difficult to navigate.
Right.
And it is certainly for seniors. So we help, my staff helps them unravel that the best we can. And I think we do a really good job with helping them if they have benefits.
Right.
So what we know is about 10 to 12% of the senior population, at least in this state, has traditional dental insurance.
Oh, okay.
So not too many. And we're finding, and even the seniors will tell us, if I were healthy and only needed a few checkups and things like that, that would service me well.
Okay.
However, we know that over 12 years we've polled most of our folks haven't been to the dentist in 5 to 7 years.
Wow.
In 5 to 7 years, if you haven't touched your car for any oil maintenance or changing tires, what's going to happen?
Oof.
You have this accumulation of things that build up,
Yep.
literally.
That's if it'll even start.
Absolutely. That's what happens. So we try to let them know, look, we're here to help assess and help you. Don't worry about what's happened in the past. We're here right now.
Right.
Let's put out the biggest fires. Let's address everything that's going on and just move forward in phases if we need to.
Yeah. Yeah.
And so we're finding that very few have regular dental insurance.
Okay.
Or no insurance at all.
Right.
Some have the means, some absolutely have no means.
Okay.
So it's just one end of the spectrum all the way to the next.
Yeah.
Which is really, really difficult to feel like I mentioned, that our seniors are getting proper care, because most of them are not.
Right.
Most of them cannot.
And I still think that it's almost like going to your eye doctor. People they don't think of their eyes and teeth as that needs to be checked on a yearly or bi-year or twice a year. They just don't think of it as being healthy.
It is expensive. Dentistry is expensive. I know that because of our overhead with the supplies, our lab bills, all the things that we have to pay for. Obviously, we have to charge to be able to provide the services, and trying to keep the fees down. I believe our fees are kind of medium, midland. They're in the middle. I've proven that to many, many people.
Yep.
They're not high, they're not low, they're not free, unfortunately. We are working towards a couple of grants. So we're working on some things right now. Obviously, it would be for seniors.
Yeah.
It would be for seniors. So I don't think there's a lot of funding or grants out there for seniors, but there's an awful lot for children.
Yeah.
So
interesting. Okay.
There's a lot for children, and I've heard it's because in the community sense, we want to support the future of our children.
Right.
It's considered like an investment.
Right.
But I feel like our seniors have invested in our country, and they have been the backbone for a lot of us.
Right.
And so we need to care for them as well.
Absolutely.
We need to give back and make sure they're cared for as well.
Yeah, I agree with that. I agree with that. So for those that want to connect with you, you actually will do any age group. Obviously,
Correct.
You specialize with seniors. So I know you've done a lot of you do a lot of the difficult cases, and I think people don't realize too that you also do everything.
We do.
That someone would go to a dentist
All dental
for.
services. So anything that you could have done in a traditional office, we can do in a mobile sense.
Any surgeries or anything like that as well?
We do. We do a lot of surgeries, oral cancer exams. We can do biopsies, implants, and certainly anything and everything like bridges, crown and bridge work, prosthetics, partial dentures, implant-supported dentures, periodontal treatment, root canals, fillings, anything that can be done in a typical office. Okay.
So if someone needs to get a hold of you, give us the phone number, and I know you've got great staff that will work with them
over the phone.
As far as getting them.
They can getting an appointment is really simple. They can go on our website, which is mobiledentistryofArizona.com. They can actually sign up and fill out the forms online, which is really simple. That gets submitted and sent into our scheduling offices. And then at that point, the individual in charge, whether it's the patient or the patient's spouse or family, would get a phone call. And that's where the interview process would start, and then all the details are discussed, and then the appointment is scheduled. They get direct contact with my staff, which is great. It's not just clicking a button and signing up for an appointment. You don't know who's going to show up at what time and how's mom going to be cared for and things like that. So.
And I do know, working with your staff in the past, from the time they submit that documentation or the time they call them, they're constantly just gathering a lot of information ahead of time, just so that when your loved one gets there, it kind of streamlines everything as well. So you know ahead of time what you
Right.
try to know ahead of time what kind of medications they're
Right.
on, what medical
We try to give our
conditions.
doctors as much information as possible. So we
Right.
have our checklist as well
Yeah.
for their patient chart, if you will. And we try to make sure all that's ready
Yep.
and all the consent forms are signed
Yeah.
before that patient is seen. That's really important
Yeah.
to be able to proceed with care. You know, when we go and someone has expectations
Yep.
to receive care, we want to make sure everything's in place.
Yeah,
Correct,
absolutely.
and doing it correctly.
Right, absolutely.
Mm-hmm.
Well, I love the dentists and the doctors that you have there. So
Thank you.
So we'll have Ann
great.
back in another, maybe another month, and
Sure.
and let's do some more because you've got so much good information on
Sure.
on dental care for all seniors and for
For
their
all age
families.
groups. There's
Yeah.
some really great products. Something that we could talk about would be products.
Absolutely.
And new devices that are coming out.
Yes.
That would be really beneficial.
Yeah, I think that would be fun.
Yeah.
Because I've seen you at conferences, so I know exactly what you bring and
Sure.
how fun you make it. So we'll have Ann back again. So if anybody needs to call Ann or someone in her office, her phone number is 480-313-8000. That's 480-313-8000. Thanks, Ann, for coming.
Thank you. This was great.
Yeah, and we'll see you next week at Solving Life's Next Chapter.
Thank you.